Hello everyone, this is 𝐃𝐤𝐫𝐿, brand ambassador of Viet Plastic Surgery Hospital, and beside me is Dr. 𝐃𝐢𝐫𝐞𝐜, director of Viet Plastic Surgery Hospital. For the previous live streams, we've discussed problems regarding breast augmentation and rhinoplasty, and as promised in those previous live streams, we will have a thorough discussion regarding every issue, concerns revolving around filler and Botox injections, the two of the most popular beautification methods nowadays. And that's exactly what we are gonna do for this live stream session. What is great about these methods is they are non-surgical, in addition to shorter downtime, which is what I think that makes these two methods a trend among the clients. For that reason, today Dr. Trai will answer everyone's question about what filler and Botox are, what their effects are, and address common concerns surrounding these two aesthetic procedures. Now, I'll hand it over to Dr. Trai so he can share his insights with everyone.
Hi everyone, I'm Dr. 𝐃𝐢𝐫𝐞𝐜, also the director of Viet Plastic Surgery Hospital, like what 𝐃𝐤𝐫𝐿 just mentioned. Today we will share our insights regarding the non-surgical aesthetic procedures of filler and Botox injections. Both of these methods are the critical choice for the clients who are not ready to undergo plastic surgeries. I'm sure that many of you are still confused about when to choose to undergo filler, Botox, injection, or plastic surgeries, which is why I decided to address all of your concerns revolving around these things today. Is there any question in the comments section, Dion?
No, doctor. Since this is only the beginning of this live stream session. Hello to all of our viewers. Everyone, please actively comment your questions in the comment section below so that we can address all your concerns regarding Botox and filler, as well as their effects. Dr. Trai, since these methods are crazy popular now, but it doesn't mean that everyone knows about it. Would you like to share your insights on Botox and filler for those who haven't known about these procedures? Now, you can share your insights on what filler and Botox are so that everyone can have a deep knowledge about these.
I will discuss filler first. Generally, fillers are substances used for augmentation. And what do those substances consist of? In the past, the substances used for augmentation were mostly made of silicone, which are also used for body parts augmentation. But because of the complications, silicone was banned. Then people started developing fillers made from a variety of materials, including hyaluronic acid instead. For detail, it is a natural substance found in our body. So it doesn't last permanently, it typically dissolves after a year. In addition, because acid hyaluronic in fillers is a substance naturally found in our body that also contributes to beautifying and moisturizing our skin. Fillers are typically harmless for our well-being. About when to inject fillers, because fillers literally means filling substance. We inject it into areas that are lacking in volume, such as lip, cheeks, chin, even nose to make them look more fulfilling. Even with hollow eye corners, we are able to inject fillers in to make them more full. In general, fillers are capable of injecting into any areas that are hollow or lacking in volume.
So, in conclusion, filler is a substance used for augmentation. Once injected, it causes no harm to our well-being. And even better, the method is non-invasive and doesn't require any follow-up plastic surgeries, in addition to immediate results. However, the drawback is that the effects don't last long. Typically, you'll need a subsequent treatment after about a year, right?
It depends on the manufacturer's quality. Normally, for the world-leading Juvederm filler from the US, the effects will last in about 2 years. For those fillers from Korean or Chinese manufacturers, they may last only 3 months. Generally, the quality of the fillers matters.
Would you like to unbox this filler box so that our viewers can see it? Since there are currently various types of fillers in the Vietnamese beauty market nowadays, Doctor, would you like to provide your insights on these different types of fillers, including the prices and the differences between all these fillers? At the same time, there are some fake fillers made from silicone. In cases where clients unknowingly use these fake products, some have experienced severe complications, even tissue necrosis. So, Dr. Trai, please tell everyone more about these cases so they can better understand.
Let's say fillers are made from hyaluronic acid, HA for short. And because filler is injected into our body, it has to be dissolvable. And because HA can be easily dissolved in our body, it is used to make filler. The maximum duration is 2 years. Any undissolvable substance is unacceptable because it is made from silicone, and silicone doesn't dissolve. So if anyone says that their filler is dissolvable, that is absolutely correct. But if it's not dissolvable, don't use it, because there's no such thing as a permanent filler that the body can safely accept. Secondly, HA fillers come in various types from the US, Europe, Korea. Their prices vary greatly, so it's hard to list them all. However, reputable facilities always use the highest quality fillers, which typically last from 12 to 18 months, while other fillers may last from 3 to 6 months, depending on their price and quality.
Which means the higher the price, the better the quality of the filler, and with better quality, the longer the filler can be maintained.
And the fewer subsequent treatments we must have. When we inject a type of low-quality filler in, it dissolves unexpectedly quickly, so we ought to have subsequent treatment just after 3 to 4 months. That is why we should inject filler from a high-quality brand.
Dr. Trai, Nguyen asks, Doctor, I had my rhinoplasty 10 years ago, and I'm thinking about removing the implant. Will it be very painful, and will it cost a lot, doctor?
Generally, implant removal is really simple, with an affordable price. The worthy question is, does she want to place a new implant in? Because her nose is already looking beautiful. Why remove it without replacement?
I have my own concern as well, doctor. Take an example of when clients would like to make their noses look more sophisticated. They are considering between undergoing rhinoplasty or filler injection. Would you like to share your insights on what the pros and cons are for both of these methods, and which method is more beneficial for us?
Well, filler is a substance that's mostly used for augmentation. For example, if we have a short nose, filler is able to raise the nasal bridge up to create a better-looking nose, but unable to lengthen the nasal tip. For people with upturned and short noses, filler cannot correct the shortness and lift the tip. Therefore, we need to distinguish between cases. If someone already has a sufficiently long and high nose tip, then filler can be used. But if the tip is short or low, filler isn't suitable in that case. Plastic surgery is needed to lengthen and raise the nasal tip.
You mean filler is only suitable for people with a beautiful nose shape and long nose tip, and they may be able to use filler to raise the nasal bridge up. And for those who have a large and flat nasal tip, rhinoplasty is the better option.
Yes, to make the nasal tip look more efficient and raise its projection. Secondly, filler is banned from injecting into the nasal tip. If you are uninformed, then inject filler into your nasal tip. It will cause necrosis to the nasal tip. There have been numerous cases of nasal tip necrosis due to filler injection, and because there are various blood vessels located at the nasal tip. If we unknowingly inject filler in, it will cause blockage of the blood vessels.
And I just remember, I also would like to ask about the cases I've seen on the internet recently. There are several girls who maybe have visited unreputable beauty facilities. In the end, after a while of having filler injection, they suffer from nasal tip necrosis. There are also people who discovered that they have not filler, but silicone injected into their noses when having it removed. Can you share further on how to become wise and informed clients? How to make sure that while achieving beauty, we also protect our well-being in the safest way possible?
Generally, you must have a deep understanding of what is the substance being injected into your body. As you may know, with all of the information technology available, first of all, ask yourself, what is the brand name of the filler being used on me? Look it up online. Then you can have all the information about the product and the manufacturer. Unless it's a counterfeit product, you'll be able to verify everything. But if it's genuine, there's nothing to worry about. With that being said, the outcome still depends on the doctor's skill.
I also think the doctor's skill is the most important factor, because honestly, there are many so-called doctors who are not fully equipped with medical knowledge as well as on how to avoid damaging the blood vessels while injecting filler into the nasal tip. Can you give further insights into this issue, doctor?
The thing that matters the most is the doctor's skill. Even when using the same kind of syringe to inject fillers, each doctor does it differently. A doctor with a good sense of aesthetics will make the nose look naturally beautiful, while the doctor who only focuses on making it look higher will not achieve a pleasing result. So, when it comes to beauty, the doctor's expertise plays a huge role. Next up, about the complications, if the doctor understands the anatomy of the nose and the blood vessels. They can minimize risks, such as accidentally injecting filler into a blood vessel, which can cause blockage and cause tissue necrosis. In general, it all comes down to the doctor's expertise and experience.
We have mentioned everything about the advantages of fillers. Now, onto the opposite side. Can you share all the cons regarding fillers?
I already mentioned that filler causes no harm. Since it is made of HA, the only thing is that it is pricey.
Filler is definitely pricey, as the usual cost of other beautifying methods as well.
Not only is filler pricey, you are required to have revision treatments. For rhinoplasty, it only requires a single procedure. Then it is normal for the results to be maintained permanently. But for filler injection, you are required to have revision treatments a year later or two. Secondly, there is no complication or harm if the doctor injects it properly, aside from accidental blockage. The good thing is there is an antidote, and it will resolve the issue without causing harm. Overall, filler itself doesn't cause any real damage.
So, ladies, there is nothing more you have to worry about. When you visit a reputable beauty facility with an experienced doctor, you won't have to worry about any harmful effects of the filler. Because if it's a genuine, high-quality filler, it won't cause any damage when injected into your body. And I believe that as women, we all have the desire to enhance our beauty. So we should always choose trustworthy beauty facilities to avoid any unwanted consequences. Being beautiful is important, but maintaining your health is even more important. All right, now I will check out a few questions here. One of them is from Sammy Tran, who asked, "Doctor, can we inject filler to correct under-eye bags?" So, doctor, can you tell which areas of the face can be enhanced with fillers?
I'll explain from the bottom till the upper part of the face. If your chin is lacking in volume, we can enhance it with filler. Same for creating volume for lip and smiley lip shape. For deep nasolabial folds, we can fill those lines as well. Same for the nasal bridge. Filler is capable of raising it up. As for the eye, over time, the under-eye hollows can become more sunken, and in that case, we can inject filler to make them fuller. But if you have eye bags, a lower eyelid surgery to remove excess fat is required.
Oh, so we have to perform a surgery.
Exactly. But if you have hollow lower eyelids, you can just inject filler in to fill them up. Same for hollow cheeks, they inject filler in to fill them up. In general, you ought to understand that filler is an augmentation substance.
I see that periorbital fat grafting is also extremely popular among the clients. So doctor, among filler injection and autologous fat grafting, which one do you prefer more?
They are both substances used for augmentation. With fat grafting, the filling material is your autologous fat. It's taken from your body, usually from the lower abdomen, and then injected into other areas. If you have the means to use your own fat, that's excellent because it's natural and comes from your own body. Secondly, your autologous fat contains stem cells, which help smooth and rejuvenate the skin wherever the fat is injected. So, if possible, fat grafting is the best option. However, there are certain areas where the fat doesn't survive well, for example, alongside the nasal bridge or the chin. That's why the fat grafting method is usually limited to certain areas such as the cheeks, temples, forehead, or under the eyes, where the fat helps restore your youthfulness and create a naturally beautiful look.
But autologous fat grafting will cost a lot more money than filler, right?
Although the cost of autologous fat grafting is roughly double that of filler, the results will be more beautiful and persistent for a lifetime. Here's how it works. When we inject fat cells into our body, 50% of it will survive. For example, if that area needs 10 cc, I'll inject 20 cc, and the remaining 10 cc will stay with you permanently. So, you won't need follow-up injections.
The results of autologous fat grafting will be permanent. For filler, we must have subsequent treatments a year or 18 months later.
And the combined cost of different sessions is more expensive. Secondly, fat grafting is superior in terms of skin improvements.
What about fillers for breast augmentation? Can we inject filler to enhance the breasts aside from breast augmentation surgery?
There are fillers for breasts and buttocks, but they are too expensive. Let's take this one CC tube, for example.
This one, right?
Exactly. And it costs 10 million Vietnamese dongs for a tube. Let's say you order 200 cc of this filler. How much do you think it will cost you? Maybe several billion VND, right? That's why the market for this service is almost non-existent.
But I think there are two different types of filler. There are fillers specifically for the face, and others designed for different parts of the body with various prices.
No, the filler used for various body parts are all made of HA, and the price depends on the volume used. Like the one from 𝐕𝐢𝐿𝐻, it is suitable for the lips, nose, chin, etc. But the price remains the same.
That means we don't have a type of filler specifically for breasts and buttocks.
There is, but what I mean here is that filler is customizable for every body part, because the level of HA in the filler is high. That's why it's capable for the lips, cheeks, buttocks, and breasts as well, but it's very pricey. So if anyone has the favorable conditions, only then they will inject fillers for the breasts and buttocks, while others don't most of the time. Also, don't ever inject silicone.
That's right. Nguyen would like to ask that, Doctor, after the filler dissolves, will the original shape still remain?
Filler binds water to create volume. So, the shape returns to normal when the filler completely dissolves.
For example, the volume is 100% in the year I have the injection. Then, after a year, the remaining volume will be
dissolve entirely.
And I must have a revision treatment a year later.
You can have a revision treatment when the filler almost dissolves entirely, so it can keep the volume.
So, Nguyen, for your concern, the filler will dissolve entirely after a year. And if you would like to refill the lacking areas, you ought to have a subsequent treatment.
Like I just mentioned, no one uses filler for buttocks and breasts augmentation, but uses autologous fat instead. Here's a great thing about autologous fat. When you graft the fat into your breasts or butt, when you gain weight, you won't gain it in your belly anymore. Because among the fat we use to graft, there is this memory cell. When we eat, these memory cells will locate the area needed to transfer the fat. So the more you eat, the more fat will accumulate around these cells, filling the breasts and buttocks volume first, then the abdomen.
I think we will discuss autologous fat grafting in another live stream in the future, as the scope for this live stream is Botox and filler. Next up, we will move on to Botox, and it is entirely different from filler. While filler is used for filling and augmentation, Botox is used to reduce the area where it is injected, right? If not, how does it actually work?
What exactly is Botox? First, Botox is only the commercial name for the product when it is actually a type of toxin, specifically a bacterial toxin extracted from certain bacterial components. You can see it written right here. Botox contains a very low concentration of this bacterial toxin, and what does it do? It helps soothe out wrinkles and temporarily paralyzes the muscles. So, when Botox is injected into an enlarged masseter muscle, like from years of heavy chewing or eating, the Botox causes that muscle to gradually shrink. Like when you work out, your muscles grow, but when you stop, it shrinks.
May I unbox this so that everyone can see it?
What will Botox do? It will paralyze and shrink my masseter muscle. Then my face will be slimmer. I repeat, it's Botox, not filler, and their working mechanism is distinct. What Botox does is that it will temporarily relax the muscle so that it stops moving. Just like if you stop moving your arms, the muscle becomes smaller. The masseter muscle is usually injected at the jawline to make it slimmer and create a slimmer face. There are two main ways to achieve that. The first is by injecting Botox to reduce muscle size, and the second is by performing mandibular angle reduction. Another use of Botox is to smooth out the wrinkles. It prevents them from forming at about 6 months. Its effect only lasts around 6 months, so you'll need to have a revision treatment after that. But if you continue the treatment every 6 months, the results can last longer. After the second or third session, the effects may extend up to a year or more.
So, Botox is a substance used to smooth out the wrinkles on our face, in addition to temporarily relaxing the muscles, which means, for the girls who have enlarged jawline muscle, you can inject Botox so that the jawline muscle will shrink in about 6 months, and you are ought to have subsequent treatments after 6 months.
In conclusion, Botox usage is divided into age groups. The younger generation would often use it to shrink their masseter muscle, while the older ones inject Botox to smooth the wrinkles on the forehead or around the corner of the eyes.
Yes, so when should we use filler and when should we use Botox?
I already mentioned that we intend to create volume and augmentation for different body parts, such as nose, chin, lips. while Botox is specialized for people who want to reduce their jawline to make the face slimmer or simply smoothing the wrinkles. Take me, for example. I inject Botox in to get rid of this wrinkle that appears every time I smile.
So, does Botox have any complications?
Botox is a bacterial toxin that simply relaxes the muscle and eliminates the wrinkles in specific areas. In practice, the doctors must use an appropriate amount to prevent any harmful reaction. The usual dosage is smaller than 100 times the required amount to harm the patients. So when we inject only 1/100th of that amount, it's completely safe, absolutely harmless.
So, for an example, I know that there are various brands of filler in the beauty market. So what about Botox? There are also numerous brands, right? And how does the price vary?
Then we're going to discuss a bit further about Botox. When injected into the masseter muscle, high-quality Botox will slowly dissolve in a week, then entirely dissolve 1 to 6 months later, while the fake Botox, manufactured by unlicensed manufacturers, will dissolve in 2 weeks and entirely dissolve in about 3 months. So basically, the difference lies in the quality of the product.
Yes. So with a concentration of 100 cc, we can normally use it for a single person.
No, for many people. Also, use it according to the doctor's designation, like how much for the forehead, or about 60 cc for both sides of the masseter muscle, with 30 cc each side, and don't inject it into the lips.
So normally, the young ones would usually inject Botox to treat the masseter muscle, while the older ones use it to smooth the wrinkles.
That's why people prefer to inject filler, especially among the youth.
So aside from Botox's main effect is to slim the face for the girls, I also think of another method in the market that has the same effects, which is genoplasty. Doctor, among these 2 methods, which one do you think carries less risk? And which one is more effective?
Generally, Botox will be the first choice for those who would like to enhance their facial appearance. Botox is harmless. It is unpainful if you inject it in a minute. After a week, you will see your face become slimmer.
I can see the effects in just a week.
Exactly. During the first 6 months, you will feel that your face has become much bitter. Then you want to proceed with jaw reduction surgery. And what will you get?
Permanent results.
For Botox, you must have a revision treatment once every 6 months, right? Generally, the total costs for Botox injections is higher.
Each method has its own pros and cons, right? Now, I will summarize it all for everyone who's still concerned about whether to slim down the face by undergoing jawline surgery or injecting Botox. These are the differences between these 2 methods. If clients choose to undergo jawline reduction surgery, they will have to bear the pain, right? Because the surgery is extremely painful.
It's painless because you are under general anesthesia. The surgery only causes swelling.
The swelling period will last for a while, right?
Swelling is unavoidable, but it lasts for only a month, and what you receive is permanently beautiful results. However, it's not painful at all, just swollen. So during that time, your face won't...
Which means stay at home for a month.
No, what I mean is that the result isn't at its best yet. For example, there are cases where the face still swells, but they want to attend social events a week after. Then you ought to inject Botox. But if you would like to undergo jawline reduction surgery, I will do it for you.
So that means we only need to undergo a single jawline reduction surgery. The results will last forever. The only downside is that the recovery period is quite long, for a month.
I like to call it a period that your beauty enhances.
Exactly.
Yes, while you can still do light work.
For Botox, the optimized results can be achieved with a shorter time, but you are required to have many subsequent treatments to keep the effects of Botox in the future, once every 6 months, which is also really pricey.
Yes.
I'll check some questions in the comment section now. Doctor, I injected filler from the 𝐕𝐢𝐞𝐿 brand. Now, is it okay for me to have a revision treatment with filler from a different brand?
Generally, filler is only a component of HA, so there is no problem about that. In common, fillers from all brands have this substance. If the H.A in this filler is better, it's fine, no problem. The better the manufacturer, the better the filler is.
Which means it's fine that we injected filler from a different brand last time, then we injected filler from another brand this time, so the difference lies only in the brand name. While the components are the same. Big Tran asks, what is the concentration of Botox needed to smooth the wrinkles?
Leave it to the doctors. The right answer can only come from a direct examination.
What about the wrinkles at the areas under the eyes?
We do not inject filler for those areas, except eye corners and crow's feet. The only option is surgery.
So surgery is a must.
Exactly, and again, at the eyes, only crow's feet are suitable for Botox injection.
So, only the areas under the eyes are suitable for Botox injection. Furthermore, these areas under the eyes must
remove the excess skin.
I see. 𝐃𝐢𝐫𝐵 asks, Doctor, my jaw is misaligned, so can I have a filler injection?
Like I said, for a misaligned jaw, we will inject Botox, not filler, to shrink the larger masseter muscle side, because filler is used for augmentation and creating volume. If a side of the masseter muscle is larger, we will inject Botox to make it shrink.
But I think what he means is that his face is imbalanced on both sides. So is it okay for him to inject filler for the smaller side of the masseter muscle to make it balanced?
Now we must determine which area this guy would like to reduce. If it's at the masseter muscle area, then filler injections are not possible. Because no one injects filler into a moving muscle area, it will dissolve completely. For example, if it's the cheeks, one cheek is flat and the other cheek is fuller, and you want the flat cheek to be as full as the other, then you can use filler or autologous fat grafting. But if it's the jawline, specifically the jaw angle he mentioned, you can never inject filler there because the filler would go into the masseter muscle area and dissolve entirely.
Do Hong Deem would like to know whether filler or Botox can eliminate dark circles under the eyes.
In what specific area are the circles lie?
Here, under the eyes, doctor, normally, girls would stay up late, so the dark circles would also form under the eyes.
Then that's okay.
So can filler eliminate dark circles under the eyes?
We inject filler to rejuvenate the skin at that area under the eyes.
Our viewers have lots of concerns about issues related to jawline reduction surgery and chin augmentation. So I guess we'll address these concerns as well. Dr. Emmy Tyan asks whether she can have both chin augmentation and jawline reduction surgery at the same time. Does it affect our well-being? Or do we have to perform these surgeries separately?
We should perform both jawline reduction and chin augmentation together, because in that case, we use the same incision inside the mouth to reduce the jawline. After that, through the same incision, we can place a chin implant or perform a sliding genioplasty. So I usually recommend that if you're getting jawline contouring, you should also consider genioplasty.
So both procedures can be done together?
No, what I mean here is that both can be done through the gingival incision. In this case, we create an incision inside the mouth, perform both procedures at the same time. Finally, you should fast for a week. No, a week. And you're forbidden from eating hard food, only having light food such as porridge in a week.
Because I've heard of and seen videos about jawline reduction surgery before. I was scared watching them, because we have to make an incision here. Then insert a shaver in and trim the jawbone. Finally remove the remaining pieces of bone out, right? Also, I've heard that the recovery period would take about 6 to 7 months.
We no longer need to use shavers because both of these procedures are performed with an incision inside the mouth without leaving any scar outside. Secondly, we will use an ultrasonic bone scalpel to gently cut the jawbone.
Oh, so we have to use the ultrasonic bone scalpel, not the traditional shavers, right?
Because we don't shave the bone. When we shave the bone, the calcium will help it grow back after all. If you grind the bone, it will regrow a few months later, and sometimes even more than before.
Which means we ought to cut that part, so that the bone wouldn't regrow.
That's right. The more you shave, the more the bone will regrow. That's it.
Hong Mi would like to know which is better between injecting breast filler and breast augmentation surgery.
I already mentioned that we shouldn't use filler to create volume for the breasts, because the effects from injecting filler can only last for a maximum of 2 years, and filler injection would cost you way too much money, like $1 billion in 2 years. No one would ever do so. Instead, the results from autologous fat grafting will last a lifetime, and the price is also reasonable. So forget filler. You can only choose between breast augmentation or autologous fat grafting. Again, there is no such thing as a filler for breasts and buttocks augmentation, and no patient can afford spending way too much money for the method that can only last a year.
So now, for those who are still wondering should filler injection on breasts and butts be done, Dr. Trai just advised that you shouldn't, because the price isn't worth the benefit. And people would only use filler for the parts that are
small in volume.
yes, and on our faces that you would like to create more volume to make them look more filling, nose, chin, cheeks, for butt and breasts. You should undergo augmentation surgery or autologous fat grafting to have the results maintained permanently. Here, Ni gave us an interesting question. She asks, if I injected filler in the chin area and got infected, will the bruise from the infection disappear after I inject the antidote?
I must have a direct examination on her. I can't just tell exactly her case simply through words like this.
I think what she means here is that she had a filler injection somewhere in her chin and got an infection there. Then the chin area becomes darkened. Now, for example, if she comes here and wants to have a revision treatment, will the dark, hardened area eventually disappear?
If the bruise has appeared on the skin surface, we must examine it to determine how to treat it with laser therapy. As for the inside, it's fine. Once the filler has been dissolved, there's nothing left to worry about.
For Ni's concern, I think you should visit Viet Me Plastic Surgery Hospital so that Dr. Trai can have a direct examination on your skin condition at the chin area. Van Vo asks what should he do if his cheeks are a bit high?
Just perform zygoма reduction.
Zygoma reduction?
That's right. Or we can perform rhinoplasty or just inject.
What do you mean by zygoma reduction?
Well, the procedure is done with an incision in the upper jaw. Then we cut
the cheekbone.
That's right, to lower the cheeks. That's it. Or, when our nose is too low, we augment the nose, then the cheeks would appear lower. On the other hand, whether the cheeks or the temples appear too hollow. We can perform autologous fat grafting to make the cheeks appear lower. There are various ways, generally.
Hong Dian Nguyen gives us a very long question. Doctor, can I ask something about rhinoplasty and double eyelid surgery? I have a flat nose, in which the nostrils are too large for my face, and my eyes are both single-lidded and slightly slanted. If I want to fix both my nose and my eyes, but I don't have enough money yet, which one should I do first? And if I want to correct my slanted eyes, what are the steps involved? I'm also worried about the safety during the procedure. I hope you can give me some advice. This person had clearly read quite a lot about nose and eye procedures.
Generally, I must have an examination of that person's appearance. Only then, I can advise on what is good and bad for her.
It's hard to come up with a suitable solution based on these descriptions. Everyone, if you have too many questions about how to perform plastic surgeries for your face, for any part or feature of your face, you should visit Viet Me Plastic Surgery Hospital. That way, Dr. Trai can see you in person and give you the most detailed and accurate consultation. Because honestly, just reading and hearing your question like this makes it really hard for us to provide the right advice without seeing you directly.
Especially when it comes to surgical or non-surgical cosmetic treatment. There's always a process that contains a sequence of steps. For example, if someone visits the hospital, I'll ask first what procedures they would like to undergo, followed by considering their current means. Once done, I'll guide them through various steps. Someone eligible for various procedures would ask me, "Doctor, what should I do first?" Then I'll say, well, each part on your face has various levels of attractiveness. Let's say the chin will increase in 3 more points for attractiveness, while the eyes and nose can increase by 1 point each. You can choose freely, maybe the chin first. And it's not that you have to do everything at once. You might not have budget for all, but I'll guide you on which option is the best and most balanced result on your face.
I think the same, doctor. 'Cause I also believe that you should visit the hospital to have a thorough consultation from the doctor to know what exact method to choose to improve a specific part on your face, and based on that you also can make the best decision for yourself.
And the consultation is free of charge.
Exactly. You guys should remember that when you visit Viet Me Plastic Surgery Hospital for a consultation, it's completely free, and at the hospital, you can freely ask any question about your face or the cosmetic procedures. Dr. Trai will address it all for you in this 100% free consultation. Amy Tran would like to ask on injecting filler to create baby-shaped lips.
Don't use the word baby lip when you visit the hospital for a filler lip injection. Inform the doctor directly on your favorite lip shape. Don't ever use the word baby lip.
We should only call it lip injection because the shape of the lips are
different,
and one style may suit you better than another.
So when you come in and say, "I like this kind of lip shape," before the injection, the doctor will clearly discuss with you whether you want your lips to be fuller overall. or which parts you want to be thicker or thinner. The doctor will talk to you directly and ask, okay, what kind of lip shape do you like? Then based on that, the injection will be done exactly as you prefer, because there are lots of beauty facilities using that baby lip term. It confuses me, even though the procedure is the same for all types of lips. So it's better to directly mention your preferred lip shape at the consultation.
Honestly, many people would see the images online. Then they ask the doctors to shape their lips exactly the same in the images. But that's not exactly the optimized approach, because each face has its own proportions. You'll only look beautiful when any feature you change still harmonizes with your overall facial structure, not by trying to copy someone else's lips or nose, right, doctor? Nguyen asks, Doctor, I've already had a nose job, but my nose is still a bit upturned. Can I have another procedure to lengthen it and make it less upturned?
I told you, we can't lengthen the nasal tip with silicone implant placement. But for structural rhinoplasty, it's completely doable. If you don't have ear cartilage or...
We can't lengthen the nasal tip with silicone implant, right?
Exactly same as filler, silicone implants can only create volume for the nasal bridge and lengthen the nasal tip a bit compared to filler injection. If you want to lengthen the nasal tip, you should undergo structural rhinoplasty using rib cartilage or nasal septal cartilage instead.
Many of our viewers are also wondering about the price of the services at our hospital. Then, would you like to share the prices with them? Or do they have to come here to have a direct consultation about that issue?
Currently, I offer 2 types of filler manufactured in the US and South Korea. 5 million Vietnamese dongs for the Korean brand, and 9 million VND for the American brand.
Can you get the Korean filler, please?
I left it in the department. But generally, I only talk about...
Here, this filler from the American brand is the best and also the most expensive one.
I think you should have the one from the American brand, because it's only 9 million VND, and the effect lasts twice as long as the Korean filler.
Actually, not every client has the budget to inject this filler. For example, if they want to use filler, are there any other types apart from this one? Does the quality match with this type of filler? How much do they cost?
The prices may be less than half, but the quality doesn't match. For example, filler manufactured by 𝐃𝐢𝐫𝐿 from Switzerland costs about 7 million. But the effect only lasts for a year.
Which means it doesn't last long.
Isn't as long, and it can never be.
What about Botox?
The same for Botox.
Like, how much does it cost for 100 cc of Botox?
This 100 cc isn't for an individual, but for an entire region or body part. Take this example. Masseter muscle injection would cost you like around 6 million VND, which can be guaranteed to last for about 6 months.
Which means its price would depend on how long the injected Botox or filler can last and how effective it is.
That's right.
Hong Mai asks, I had lip filler injections, but they dissolve very quickly. Within about 1 to 2 weeks, it went back to normal. Is that because of my muscle activity or the filler material?
Because of the filler material.
I see.
Because fillers from reputable brands can never dissolve that fast.
Hung Hat Nguyen asks, Doctor, I had a pretty high nose, so can I have adjustment on both sides of my nasal alar?
You should undergo a larplasty to have your nasal alar adjusted.
Is there anything else you would like to share?
Well, just visit the hospital. Then you'll have a better understanding on what you choose to undergo through consultation. There are some treatments that filler injection is not an appropriate option. If your nose is short and you only inject filler to make it higher, you'll end up having to spend more money later to fix it. So it's better to do it properly once and for all. That's why when you decide to do anything, it's best to come in and let the doctor give you advice. I'm just saying that filler works for certain people. For instance, if someone already has a long, nicely shaped nose but just lacks a little height along the bridge, then adding a bit of filler can help. Secondly, filler is also suitable for those who want to try cosmetic treatment out but are not ready to undergo any surgery. And once they've tried it and see that it looks good,
they can proceed straight to cosmetic surgery.
That's right. Like for jawline reduction. To make it look absolutely beautiful, a jawline reduction has to be better since the excess bone is removed. Your face becomes slimmer and the results can last for a lifetime.
Someone has a question about age limits. Doctor, may I ask if it is possible to use filler at the age of 18? And for those who are still very young, would using Botox or filler have an impact on their health?
It's fine if you are 18 years old, because like I said, filler and Botox are 100% safe and don't affect.
What about those under 18?
I think those under 18 shouldn't inject these, since their body hasn't developed entirely. It's generally advised that people under 18 shouldn't use those treatments. 16 might be acceptable in some cases, but if you're younger than that, it's better not to.
Fat Tam would like to know if he can have a nasal filler injection when he is suffering from sinusitis.
When you have sinusitis, it's internal. While filler is used externally, it's injected under the skin. Remember that the nose area lies between the skin and the bone.
Which means the filler doesn't affect anything internally.
Yes, that's why the fact that you are having sinusitis has nothing to do with filler injection, since the filler is used externally. So, don't think that your sinusitis will be affected because filler has nothing to do with it.
Okay, everyone. Just now, we've addressed all your questions and concerns around how to use filler and Botox. Generally, filler is an augmentation substance, and filler is suitable for those who are afraid of pain or don't have the time for a long recovery period, but would like to enhance their beauty. The effects from filler are immediate for those who want to create volume for areas such as lips, nose, chin, or cheeks. However, the downside of using filler is that the results couldn't persist for long, and you are required to have revision treatments after a year or 18 months. And if not, the filler will dissolve entirely. For Botox, it will help shrink your muscles. For example, if you have large masseter muscle, you can inject Botox to relax your muscles and make the face slimmer. In addition, Botox is also capable of smoothing the wrinkles around the eye corners or eliminating the crow's feet. And I think no matter what, you should visit the hospital to have a one-on-one conversation with Dr. Trai. Dr. Trai will have a direct examination of your face to give you a thoughtful and detailed consultation, because the questions you're asking here can only be answered in a general sense. But if you truly want to make changes to your face, you should definitely come here to speak with Dr. Trai in person.
You can visit the official website of Viet Me Plastic Surgery Hospital to read all the information about filler and Botox that I've listed in there to have a better understanding, and from the stories in the articles, you can acquire general knowledge about these two methods, like when to inject filler, when to inject Botox, and when to undergo cosmetic surgeries. That's it. And remember this, you can never use filler made of silicone. I only advise so because silicone will affect you negatively. When you see the cheap prices of silicone, you may go to Kim Bean Market to buy a dozen liters for only 1 million VND, and maybe you can inject freely into your butt, breasts with that dozen of liters of filler you get with 1 million VND, isn't it? But when you want to remove all of that filler out, it will cost you a few hundred million VND, and you cannot even scrape it out properly. You end up damaging your body instead. So, never buy cheap or fake fillers or think of injecting filler into the butt or breasts. Authentic filler simply isn't suitable for injection in those areas. Even in wealthy countries like Japan or the US, people don't use filler for breasts and butt. Only extremely wealthy individuals. Those who can afford to spend $1 billion a year might do so, but that's very rare.
In general, Dr. Trai advised that girls should only use filler for areas on the face. And no matter what, when you've decided to enhance certain parts on your face, you should carefully research and carefully choose a beauty facility where the doctor has extensive experience and where all products used are 100% authentic. It's important to not only aim for beauty but also to prioritize your health. Don't be tempted by cheap prices but go to untrustworthy locations or use products with unclear origins. The consequences can be very unpredictable. So, we hope that all women will be wise and informed clients when making their beauty decisions.
I just say this simply. The limit for each individual is 10 cc of filler. Even if you get a good quality filler at the lowest price. Let's say around 5 million Vietnamese dongs per cc. That's already 50 million for 10 cc, and it lasts only about 6 months. So how could anyone keep using that? Spending 50 million every 6 months isn't realistic. Therefore, 10 cc is the limit that everyone should remember.
Through everything Dr. Trai has shared, you can now have an understanding on the prices of filler, and if there is any facility that promotes their fillers for a very cheap price. You should carefully consider if this is actually filler, or is it silicone, and make sure to make the best decisions for yourself. So now, our conversation has been going on for almost an hour now, And we've also addressed every concern revolving around filler and Botox. After this live stream, if there is anyone who hasn't been able to join this live stream, you can replay it to watch Dr. Trai's detailed and thoughtful sharing and gain some useful beauty knowledge for yourself. Nguyen and Dr. Trai would like to see everyone in the next live stream, as there are many more beauty-related topics to discuss. If you'd like to keep up with us, make sure to follow the official fan page of 𝐕𝐢𝐿 Plastic Surgery Hospital or tune in to Nguyen's upcoming live streams. Thank you all for watching.
Thank you so much, everyone.
𝐕𝐢𝐿 Plastic Surgery Hospital, turning dream into reality.